As we all know, COVID-19 has really weighed heavily on the health and safety of ASEAN region. And as the economies attempt to reopen, we know that regional actions to complement national efforts to ensure that essential medical supplies are available, health surveillance systems are working, that policies and capacities are well coordinated, and most especially that the system for developing and distributing the vaccine is working. So we have with us a distinguished set of keynote speakers as well as panelists who will help us understand some of these critical issues. So without further ado, let me introduce the two keynote speakers. Our first speaker is Dr. Ferdinand Moreno Fernando. He is a medical doctor by profession and he currently heads the Health Division of the Human Development Directorate of the ASEAN Secretariat. And he is also the Assistant Director there. Yes. Can you hear me? Our
Yeah,
second speaker is Mr. Ricard Elving, who is a Senior Social Sector Specialist from our Southeast Asia Regional Department. Ricard is responsible for Southeast Asia's regional health security projects, and he has also worked on designing projects on migration and regional public goods. So, Dr. Ferdinand, the floor is yours.
thank you very much, James, if I may call you that. A pleasant day to all of you. Greetings from Jakarta, Indonesia. So, being in Jakarta, we wear this traditional informal wear, batik. I don't know if you can notice it, but a pleasant day to all of you and a pleasant evening as well to my other colleagues who are in a different time zone. So, with the assistance of your secretariat team, James, no, I hope my slides can move from your end. But allow me to share relevant information and updates about the ASEAN health sector collective response to COVID-19 and future public health emergencies and pandemics. Next slide, please. As of October 14, 2020, the ASEAN region has more than 790,000 confirmed cases of COVID-19 and more than 19,000 deaths. Although this is just around 2% of the global cases, the impact of COVID-19 to the region has its health systems and socioeconomic conditions made more fragile. And if you would compare with the global case fatality rate, we have extreme ranges among the 10 ASEAN member states. This particular data set came from our ASEAN Biodiaspora Virtual Center. Next slide, please. The epidemic curve of ASEAN, which includes the 10 ASEAN member states, and based from the latest risk assessment report produced by the ASEAN Biodiaspora Virtual Center, indicates that majority of ASEAN member states appear to have been stabilized, except for a few countries, particularly Philippines and Indonesia, with still increasing transmissions. The ASEAN health sector continues to monitor the situation and explore greater cooperation to address these conditions. There are already some countries already opening up their economies. Next slide. The ASEAN post-2015 Health Development Agenda has 4 work programs under the respective health clusters, which envisions to achieve a healthy, caring, and sustainable ASEAN community and contribute to the implementation of the strategic measures of the ASEAN Sociocultural Blueprint or Roadmap for 2016 to 2025. The APHDA, or the ASEAN Post-2015 Health Development Agenda, has 20 health priorities as shown in the screen, which are operationalized through 104 projects and project activities and program activities in the respective work programs of the 4 ASEAN health clusters. So these ASEAN clusters are: first, promoting healthy lifestyle; second, strengthening health systems and access to care; third, responding to all hazards and emerging threats; and fourth, ensuring food safety. Collectively, these programs and project activities are designed to complement and enhance ASEAN member states' access to healthcare, particular to the prevention and control of communicable diseases or emerging, re-emerging infectious diseases, including addressing public health emergencies and pandemics, is the focus on the health cluster on responding to all hazards and emerging threats, as encircled in the screen. Partnerships and collaboration with dialogue and development partners, including ADB and WHO, are also important in the implementation of this health development agenda. And all of the cooperation with entities and their engagement with the ASEAN health sector are based on the rules of procedure on the engagement of entities with the ASEAN health sector as adopted by the ASEAN health ministers in 2017. Basically, this cooperation is based on the policy of no conflict of interests. In relation to the response to all hazards and emerging threats, next slide, please. The ASEAN health sector, through the existing mechanisms and platforms, has enhanced and sustained its response measures that were launched as early as the 3rd day of January 2020 in cooperation with dialogue and development partners. And this was launched and initiated when the first report of a cluster of pneumonia cases in Wuhan City was shared by China Health Focal Points through ASEAN Secretariat. As shown in the slide, the ASEAN health sector continues to have technical updates and information exchanges, sharing of good practices, production and sharing of risk assessment reports, including reports of international transmission of COVID-19, and continue to enhance cooperation and coordination in preparedness, prevention, detection, and response among health and non-health stakeholders. The sustained implementation of these activities are leveraged with the strength of the first ASEAN Emergency Operations Center Network for Public Health Emergencies, the ASEAN Biodiaspora Virtual Center, which manages the program for big data analytics and visualization, and the ASEAN Risk Assessment Risk Communication Center, which initially conducted training for risk communication and support for addressing misinformation or fake news, and existing ASEAN Health Plus 1 or Plus 3 mechanism of cooperation with dialogue and development partners such as China, Japan, and Republic of Korea. We have also networks on disease surveillance and laboratory network that were mobilized to coordinate with each other to further exchange information and technical expertise and assistance. Next slide. Following the health response of the ASEAN health sector through the leadership of its current chair, Indonesia, through the Ministry of Health, there was an ASEAN-wide response or collective response to COVID-19. So through the ASEAN chairmanship of Vietnam for 2020, the ASEAN Coordinating Council Working Group for Public Health Emergencies was created through the endorsement of its terms of reference by the respective ministries of foreign affairs of ASEAN. The composition of this ACC-WGPHE consists of senior officials coming from the foreign affairs, economic, and other socio-cultural community sectors. And it also includes the health sector representatives at the senior health official level. So all of this representations come from the different pillars of ASEAN, such as the ASEAN Political Security Community Pillar, the ASEAN Economic Community Pillar, and the ASEAN Sociocultural Community Pillar. This ACC-WGPHE is chaired by the senior official leader from the ASEAN member state holding the current ASEAN chairmanship. For 2020, this is chaired by Vietnam. Next year, this working group will be chaired by Brunei Darussalam. Basically, the scope of the tasks and responsibilities of this ACC-WGPHE will include, among others, the consolidation, review, and assessment of relevant reports and updates on public health emergencies, including COVID-19, and also supervise and propose initiatives that are multi-sectoral and multi-stakeholder. Examples of this ongoing programs include the establishment and endorsement of the COVID-19 Regional Fund, which is a contribution of all of the trust funds within ASEAN Secretariat, as well as commitments from other dialogue partners. And also the Regional Reserve for Medical Supplies, wherein there would be commitments made by volunteer countries in allocating certain amounts of medical supplies, including PPEs, and also the finalization or the ongoing drafting of the standard operating procedures for public health emergencies, which would not only involve coordination among the ASEAN health sector, but also the sectors that are coming from the other community pillars. Other programs and initiatives that emanated from this ACC-WGPHE is also the ASEAN Comprehensive Recovery Framework, and this is led by the economic sector. And this elaborates certain broad strategies with corresponding implementation activities that would ensure recovery from the current impacts of COVID-19 and mitigate its impact, and as well as ensure recovery of ASEAN member states as well as the region in emerging threats to the region. And also to encourage economic activity, tourism, as well as travel. The travel corridor arrangement has just been recently discussed yesterday. We had an ACC-WGPHE meeting yesterday. This is being led by Indonesia, and member states have already supported this. For the ASCC sector, of course, health sector is leading the response to COVID-19, and I will discuss later further initiatives under the ASEAN health sector. And other sectors such as labor, youth, social welfare, education, and information sectors have also conducted meetings to finalize the operationalization of their respective responses to COVID-19 under their own responsibility. Next slide. Collaboration and solidarity is critical in this global health crisis, and it requires cooperation of the international community. As such, the cooperation with dialogue and development partners have been harnessed and enhanced through the health cluster country coordinators and senior health officials. And this enhanced cooperation and engagement resulted to ongoing and new initiatives that aim to strengthen the current response and ensure future preparedness. And as shown in the slide, this would include, among others, the continuation of relevant programs for COVID-19 through the Mitigation of Biological Threats Program, Phase 2, supported by Canada, the enhancement of detection capacity for COVID-19 in AMS or ASEAN member states with the support of Republic of Korea, the development of an ASEAN portal for public health emergencies, Phase 1 through Canada, research and innovation initiatives on COVID-19 in partnership with agencies under the European Commission, the formulation of the ASEAN Public Health Emergency Coordination System, with the support of USAID through USAID Prospect Project. The webinars with expert panel on COVID-19 with outcomes through the development of policy briefs, and the phase 2 of the further development of the ASEAN Portal for Public Health Emergencies supported by GIZ, and the collaboration of WHO, particularly the Western Pacific Regional Office and the Southeast Asia Regional Office, in cooperation with ASEAN on COVID-19 response with the support of EU, and other technical assistance and exchanges and provision of medical supplies and equipment at bilateral and regional levels with the support of China, Republic of Korea, and Canada. Foremost of these initiatives is the priority in establishing the ASEAN Center for Public Health Emergencies and Emerging Diseases. And I think ADB through Ricard was one of the resource persons or members of the technical committee in the conduct of this feasibility study. This has concluded this week, and our senior health officials will be discussing the official establishment, the selection of the host country, as well as the recommendations of the feasibility study that can be incorporated in the first phase of the establishment of this center in 2021. Next slide, please. In addition to this engagement with other partners, dialogue partners such as the countries engaging ASEAN and development partners such as WHO or UN agencies, aside from their engagement with us, the ASEAN health sector has further synergized and scaled up all of these initiatives so that we would avoid duplication and encourage harmonization of activities. So the ASEAN health sector, through its senior health officials, have synergized and scaled up initiatives, which would include 27 ongoing upcoming health-related interventions. So the ASEAN health sector hopes that greater cooperation can be realized with ASEAN partners, since there is still the need to, number one, access regular and vital COVID-19 data and information. Second, access to resources for essential medical supplies, including vaccine. Develop regional framework for cross-sectoral coordination in response and recovery. Fourth, further align with regional and global movements through the Gavi COVAX facility, the implementation of the IHR, alignment with the Sustainable Development Goals, and alignment with the upcoming work program of the ASEAN Health Development Agenda for the next 5 years, covering the period of 2021 to 2025. And lastly, further coordination and collaboration with other ASEAN sectoral bodies and partners. So this needs became the springboard for all of this synergized and scaled up 27 ongoing or upcoming interventions to address health and health system issues, to support regional prevention, detection, and response measures. So as shown in this slide, we have 11 mechanisms and platforms that is already within the ASEAN post-2015 Health Development Agenda, including ASEAN vaccine and drug security and self-reliance. And we also have ongoing or new health initiatives, which are a total around 8, and this would include the establishment of the ASEAN Center for Public Health Emergencies. We also have 5 non-health sector initiated initiatives or activities that require SOMHD contribution. This 5, I have explained it and I presented it under the ACCWGPHE. And we have 3 new areas of cooperation with the development partners. And I have mentioned it in passing, and this is with regard to the recently endorsed cooperation with WHO, CIARO, and WIPRO, offices involved under the EU support. This was just recently endorsed, and we are going to operationalize the detailed plans for this. Second is the GIZ-supported activity with regard to the expert panel on COVID-19, as well as the phase 2 of the development or improvement of the ASEAN portal for PHE, and the USAID prospect supported project on coming up with an ASEAN public health emergency coordination system, which would provide the overall framework of all of the SOPs that we are developing related to COVID-19 and related to future threats. So with all of this ongoing and upcoming cooperation, and as elaborated earlier, greater engagement with other stakeholders are encouraged to further enhance a whole of society, whole of government approach to responding to health threats. With all of this presentation, I give my appreciation for your listening ears, and thank you very much for your kind attention. Next slide, please. Thank you very much. Over to you, Mr. James.
Thank
Dr.
you,
James.
Dr. Ferdinand. That was a very comprehensive discussion of the ASEAN response to COVID-19. Let me now give the floor to Ricard, who will now speak about the ADB health projects and programs in the GMS, including some interventions on COVID for ASEAN. Ricard?
Okay. Good afternoon, everybody. Thank you for allowing me to share some experiences from the Greater Mekong sub-region when it comes to health. I'm not alone working in the Department on Health. I have 3 other colleagues that are also engaged on health operation. I'm leading the work on the regional agenda. So I work very closely with the division that works with the regional cooperation and integration agenda. And it's important to underscore that because for ADB, for a long period of time, health security is something that has been smartly integrated under the regional public goods agenda. And so while I have a foot on the regional cooperation, I also have a foot in the health, so to say. And I'm in charge of the regional health security project that we are currently implementing. And in fact, I'm just doing a review of that project as we speak. And yesterday, I sat and reviewed the performance of our project in Cambodia. And after my presentation, I will ask Mara and the colleagues to share a short video that we have done on that project. And again, I have colleagues from the health sector here also, so I'm sure that they will fill in a little bit later. But if you can go to the next slide. So this is eventually the way we have set up. So you're probably familiar in the GMS. We have various type of working groups, and I'm coordinating the health sector working group. And due to the current situation with COVID-19, we obviously had to adjust and find new ways of communicating. Last year in December, we had our 3rd health sector working group meeting in Bangkok, which was well attended. And in fact, we had a very strong session together with the World Health Organization on health security and what we should do when the next pandemic is hitting the region. And it was quite absurd, if you so wish, that a few months later, after that meeting we had in Bangkok, that we were hit with the COVID-19 virus. So we are at the moment in full swing and implementing what we call the, first of all, under the health sector working group, we have the GMS health cooperation strategy, which I will mention a little bit more on later on. And then next to that, we have the regional investment framework that we constantly update in partnership with our colleagues from the regional cooperation division. So we are implementing the GMS health security project at the moment, and this was one of the flagship projects that we were able to do reprogramming of in the beginning of the COVID-19 crisis. And all countries except for Vietnam have used funds that was programmed for something else earlier to basically scale up the response for COVID-19. We had a unique caveat, if you so wish, in the project. Should that be an outbreak happening in the region, we could then flexibly reallocate resources to address that epidemic, and that's what we are doing. In the past, we implemented the CDC project 2, and we did additional financing for that, and we did the CDC project 1 as well. So we have a long footprint, if you so wish, when it comes to health security in the GMS region. And there are a few staff in ADB that have been involved in this as well. And I'll also come back to something that we did earlier with ASEAN. And I'm glad to see that Najib is part of the meeting today, because we work together on that also. Next slide. So in 2019, the GMS region agreed on what we call the GMS Health Cooperation Strategy. This covers the GMS region, and basically has 3 pillars. One is the strengthening of national health system to address transnational health threats and health security as a regional public good, and that's very much what the health security project comes under. Then we are having the second pillar, which is about challenges on health, impacts and results of connectivity and mobility. I will mention a project that we are currently preparing on that as we speak. The pillar is on health workforce development. This is a pillar that we have not necessarily been very strong on at the moment, but we are mobilizing additional resources and now looking into on how we can capture this. And this will be particularly useful when we discuss engagement on doing support for vaccine. This is then being reinforced by the long-term strategic framework for the Greater Mekong Sub-region, which is now at the final stages, and a new COVID-19 response plan for 2021 and 2023. Both these strategies or frameworks have very strong statements on health, and we have been contributing to that, and we're very pleased that the health commitment is also owned beyond the health sector. Countries in the region understand the cost of inaction, of not spending resources on building up health system to address, for instance, potential future public health threats and what we are now seeing like COVID-19. So we are very happy to see that. This is also aligned with the WHO's international health regulations and ASEAN's commitment on COVID-19 response. Next slide, please. So essentially what we aim at, particularly when it comes to the health security agenda, is to prevent, detect and respond. And here are some of the fundamental pillars that we try to emphasize when we are strengthening the health system. And these are central to our health portfolio. And I have just come out from 2 additional financing projects where all of this is at the center of the discussion. Next slide. So in the beginning of the COVID-19 situation in late March, I was involved in 2 initiatives. One was the first one when East Asia and Southeast Asia added an extra $1 million each into regional technical assistance that I'm currently managing together with Najib. And this regional technical assistance is still up and running, and we are now trying to support the countries to scale up various health responses to that. That was the first TA that responded to COVID-19 and ADB, and the president and our two DGs was immediately committed and supported us to address what was relatively unknown by that time, but they realized the severity of the situation. Later, obviously, we have seen on how our region in the GMS have managed to provide what we call the CPROS response, which is the bigger budget support to the countries. And what you see there on the left side is basically the total budget of the CPROS. And on the right side, you have seen how much we have allocated for health within those CPROS. And we are now starting to basically do the monitoring of these various programs. And last night we had a first consultation with Cambodia and see on how we can engage with the Ministry of Finance and the Ministry of Health in reporting back on the DMFs that was approved. And this is obviously the region's flagship program, complemented with a few projects that I'm going to mention now also. And let me also mention below there you see what we call emergency health grants. In the beginning of the crisis, again, we approached what we call the Asia Pacific Disaster Risk Fund. In the past, ADB had not recognized pandemics as a disaster within that particular fund nature. At that stage, we pushed and we explored if we could have support from the fund in Philippines, where we later set up a pandemic lab. And the organization met at the management level and agreed that the fund needs to be tweaked to basically accept a pandemic response. Subsequently, many countries went to the fund and asked for similar support like we did in the Philippines. You can go to the next slide. So this is basically the programs that we are doing at the moment, and we call it the Caris Program as well. So we can go next to the next slide immediately. So in terms of the future action, we have just started a discussion now with DFID on $6 million allocation for the GMS region, and I'm in touch with Patrick and Dodo and their shop now to see how we can support the region. This is on a technical assistance, and the dialogue has just started. The last couple of months, we have done a few projects in the region. The health security project that I'm currently in charge of, we have done additional financing in Lao PDR of 20 million. We have just last week approved additional financing for Myanmar of 30 million. And as of last week, we have also got a confirmed request from Cambodia that they would like to do additional financing for the health security project. This is over and above the reprogramming that we have done in the past. Obviously, we have the discussions on vaccine going on at the moment, and we in our team now are likely to develop a new TA, most likely outside the $6 million that we have from the FID, to see how we can support the countries to basically scale up and be ready when a vaccine will be available in the region. So here we are already advancing our positions when it comes to support to Indonesia and Philippines, and dialogues are happening as we speak. We are also going to have a regional dialogue on vaccine support in the end of October, beginning of November, with the GMS Health Sector Working Group. Then we have a new project in the pipeline, which is about migrant and mobile populations in the Greater Mekong sub-region. And here we have just started to design the project, and we had yesterday, again, a dialogue with the Ministry of Health, Ministry of Public Security, those in charge of customs, and other ministries, on how we can work together to beef up and support cross-border health services in the GMS region, to basically see on how we can support that the economies can kickstart in the future with the help of the health services. And we will be working with Laos, Cambodia, and Myanmar under the project. And certain sites, geographical sites, are now being determined, and see on how we can support various cross-border health services. This also includes quarantine services and isolation wards, etc. So if anyone is interested in that project, you can come back to me later on. Next slide. So I was thinking a little bit when we said that we would have a conversation with ASEAN, and I've been lucky to be able to work with them in the past, and it's been a joy. And I had also the opportunity to participate in some of this technical dialogue with this health emergency center that is now being set up. And I thank you for that, Ferdinand. We look forward to continued collaboration. But what I would like to do here on a few slides is also to make a few proposals on how we can institutionalize the collaboration between ASEAN and ADB and the GMS region. I think there are a number of opportunities that we can consider as we go forward. And I have seen in the last couple of months there are various areas where we not are overlapping, but rather that we can see the complementarity of the two institutions. So one is eventually on migration and health, and that I already mentioned. Another area that we will be covering in the migration and health project is eventually digital health solutions. And here we are also looking into, with support from our high-level technology fund, on how we can consider electronic medical records and how one can cross the region by using jointly understood electronic medical records. This is something that is being discussed in Laos, and we are considering this as part of the regional project. We can go to the next slide, because I've already mentioned the ASEAN Center for Public Health. Then we have just recently started a new initiative on One Health. This is looking into the nexus between animal health and human health. And we are working with Nosal Institute, and they will be working on a multi-sectoral approach, reaching out to various type of ministries in the region in charge of environment, agriculture, rural development, and health, and see on how we can document the evidence-based practices that the region already have, and also to see on what type of solutions that we can provide in the future, particularly from a multi-sectoral point of view. This also includes the ministries of economy, because if you rewind the clock, you will see that both SARS, MERS, and COVID-19 are all diseases that derive from the link between animal and human health. And then essentially, coming back to the discussion on vaccine, we have seen that we have large gaps on capacity for vaccine manufacturing, as well as regulatory capacity for medical products. We did this in the past with support from the Regional Malaria Trust Fund, and that was quite successful, and I think we can consider to replicate that. So vaccine will be one of the key areas that we'll be addressing going forward, and I hope you can join us in the conversation that we will have in the end of October. And lastly, we are very keen to explore also on how we can continue to foster intra-regional capacity building and learning exchanges and skill transfer across the region. And I do believe that ASEAN have a good experience in this that we can tap on. I think I have one more slide, and that should be it. Yeah, Okay, so
Thank you. Thank you. That was really a very good complimentary presentation to ASEAN. And I think we will now play a short video and then before we go into the panel discussion. Mara, can you play the short video?
Due to increasing flows of people and goods across borders, the Greater Mekong subregion is a hotspot for communicable diseases such as rabies, measles, dengue, cholera, and avian flu. But the 6 GMS countries have done well to keep infections of COVID-19 to a minimum, at just over 6,000 at the start of September, according to data from the World Health Organization and the Johns Hopkins University.
The success of GMS countries in controlling COVID-19 is not surprising. The key is years of effort to improve their ability to detect, respond, and control emerging disease threats so they can mitigate a pandemic's human health, economic, and social impact.
Through 2 decades of investments, ADB has supported GMS countries' efforts to develop core health system capacities for responding to public health threats, while simultaneously building a foundation for enhanced regional cooperation on health security. That includes $125 million in loans and grants to Cambodia, Lao PDR, Myanmar, and Vietnam through the GMS Health Security Project. The project allows funds to be quickly reprogrammed to address major public health emergencies. When COVID-19 struck, reallocated funds helped government purchase PPEs, ventilators, bedside monitors, and other equipment. The project also allowed governments to adopt new measures to control COVID-19, including the rapid dispatch of thermal scanners to points of entry. Myanmar, for example, will receive $30 million in additional financing to help the government make immediate investments in 31 district and township hospitals across the country, including capacity building for the health system to respond to COVID-19 and other future public health threats. In May, the project allocated $20 million for Lao PDR to purchase essential medical equipment, including testing kits, medical devices, and ambulances.
ในนั้นเป็นรวมของที่ ADB เพิ่นช่วยเหลือมาเพื่อว่าป้องกันเฮาเองเป็นตัวอย่างที่ว่าซบมือเป็นหมวกเป็นมัดอัดปากเนาะเป็นเสื้อกาวเป็นสิ่งที่ป้องกันเฮาเองเพื่อบ่ให้พยาธินี้ระบาดไปสู่บ่อนอื่นแล้วก็สู่แรงงานที่มาพักเสาอยู่นี่แล้วก็ภาคส่วนเขาเจ้าก็ต้องมีมัดมีหยังใส่เพื่อป้องกันบ่ให้แพร่ระบาดจุดหนักก็แม่นพยาธิโควิด -19 ระยะนี้ที่กำลังระบาดอยู่นี่
The project is in line with the GMS Health Cooperation Strategy, under which countries are committed to improving health systems' performance in response to public health threats.
คิดว่ามีการระบาดแล้วพวกเรามีแต่นั่งแล้วเห็นว่าการระบาดต่างๆอันนี้ได้ลดข้อมูลแหกลงการร่วมมือระหว่างประเทศในรูปในน้ำของนี้ที่ให้พวกเราได้ร่วมมือกันใกล้ชิดกันหลายขึ้นใกล้ชิดกันหลายขึ้นและมีประสิทธิผลหลายขึ้นในการควบคุมพยาธิต่อ
With proactive planning and investment in health and other sectors, and the support of partners like ADB, the 6 countries of the Greater Mekong subregion are meeting the challenge of this pandemic and ensure a faster economic recovery.
Thank you, Mara. Now let me introduce our distinguished panelists. Our first panelist is Dr. Nima Asghari, who is the director of the Asia Pacific Health Observatory, or APO. APO is a partnership between the WHO, the ADB, and the World Bank. Dr. Asghari has over 20 years of experience in public health development and health systems, focusing on strategic planning and coordination of development across multiple partners. He joined the APO Secretariat in 2016. Dr. Asghari has also been with WHO since 2004, helping set up various health systems in the different countries. Our second panelist is Dr. Eduardo P. Banson, also from the ADB. He is a principal health specialist in the Sustainable Development and Climate Change Department. He champions universal health coverage and has provided technical support to the development of universal health coverage in many countries in the region. Before joining ADB, Dr. Banson or Dodo was also with the WHO as a regional advisor, and he was also formerly the president and CEO of the Philippine Health Insurance Corporation. Last but not the least, our third panelist is Ms. Anna Fink, who is an economist with our Regional Cooperation and Integration Thematic Group, also in the SDCC. She leads the research and technical assistance relating to regional cooperation and integration with focus on Southeast Asia, the Pacific, particularly on issues of regional public good. So without further ado, let me call on Dr. Asghari to deliver his opening remarks and response to the 2 keynote presentation plus the video. Nima?
Thank you very much and good afternoon, everybody. It's a pleasure to be here. Thank you, James. Thank you, Fernando and Ricard for those fascinating presentations. Let me start with a little bit, if you don't mind, about the APO. It fits into this. As James mentioned, we are a partnership hosted by WHO. And in addition to the ADB and the bank being member partners, we also have member states directly become member partners. So that's Thailand, Philippines, Singapore, Korea, Australia as the member partners of APO. And our aim is to generate evidence and try to push evidence into policymaking realm within the Asia Pacific and focusing very much on evidence generated in Asia Pacific. On COVID front, we actually are publishing a number of monographs which are focusing on the country's health policy response to COVID. So we've published Thailand, and in the next 1 or 2 months, we'll be publishing South Korea, New Zealand, Japan, and Sri Lanka's response. Again, purely on the policy side. And I think that's an important issue for us to do because it's a collaborative work which we are doing with the European Observatory, our sister observatory in Europe, and it tries to very systematically capture across the various outbreak issues as well as health systems issues, what have been, and outside of the health sector, what have been the major factors which countries are grappling with and the changes that they had to make. And as part of that, I just wanted to highlight a couple of things which I think is common to both themes, to both presentations. One of them is the HRH. And importance of human resource for health on the technical side as well as on the much more longer term developing enough doctors, nurses. We know that the region has got a major shortage of health workforce, and those issues could be actually a future challenge, I think, for everyone. I am really excited with regards to the ASEAN Center for Public Health Emergencies and Emerging Diseases, and I would, like to learn a lot more about it. I was in UK when the European Center for Disease Control was created, and I know very much as working in public health in UK, ECDC came one of the after 9/11, but a lot of the work that they were doing was around bringing up all the various networks which were already there, disease surveillance network, which were already in place together under one umbrella. And so I'm keen to learn more as to how the ASEAN Center for Public Health Emergencies is going to work on that, and whether or not we are looking at about just collating the data, standardizing the data, or is it going to go further with regards to analysis, and then how is it going to recommend actions to the policymakers at the regional level, at the subnational level, at the national level, etc. And I think that is one of those issues that is an important factor to tease out is what is the location, the place of the center, and how it's going to be collaborating and influencing the policymakers. I think a lot of the conversation that we are having on a longer term wide is about health system resilience, and that fits in very well with various ASEAN clusters that we're talking about, because it's about not just about how the system is responding to the acute issue, in this case being COVID, but also how it's also responding to other health issues which are going to be there. NCDs are going to be there, trauma will be there, UHC issues and health financing will be there, and how can we actually look at those? And certainly there are examples in some countries where they are shifting. If you look at Thailand as an example, we are seeing that Thailand shifted a lot of their contractual healthcare workers into civil service contracts, in effect creating an increased national budget as opposed to hospital-based budgets, but also giving those nurses a sense of security which they wanted, and I think that fits into some of the other work that is being done on the regional cooperation and the GMS which Rickard was mentioning. I think one thing which we do need to look at more and more is, and how to engage with, is the role of private sector in most of our countries, and how we can engage with them on both academic and R&D side as well as the service delivery. They are a big player in a lot of the countries in the region, and how can we use them? And I will talk possibly more about that later on as Q&As come in, especially when it comes to vaccine distribution of the COVID-related vaccine. I think if that's okay, I will stop here. I think I've more or less used my time, and I'll give it back to you, James.
Thank you, Dr. Asghari. Now let me call on Dr. Banson to also respond to the presentation as well as the Dodo.
Yeah, James. Yeah, sorry. Okay, can you hear me, James?
Yes.
Sorry, I've been having problems with my with Wi-Fi.
Okay. Yeah, you cannot turn on your video, no?
My video is actually on, so I'm having problems. So, but it's okay. I think I have a nice picture anyhow. So, okay. First of all, thank you for the presentation, Ricard and Ferdinand. And it's great to see and hear about Southeast Asia, about how, in a sense, Southeast Asia is doing so well. So the slide of Ferds was so powerful to show how Southeast Asia, in a sense, have really done much better in addressing COVID. But of course, there's a caveat. And I think this is work that we in ADB should work on. It's clearly the GMS countries are doing so much better. Also, we are hearing, of course, that Myanmar is seeing a spike. They're now hitting about 2,000 to 3,000 cases a day. The investment of ADB in the GMS have clearly contributed in addressing and helping these countries manage COVID. Unfortunately, this is not a story we hear globally. I think even within the bank, a lot of our colleagues don't know about the great story of the GMS. So I think this is something that should be written up quickly by our colleagues in the RCD and show how in the sense, lessons here that can be used by other countries. The second set of countries that we have in ASEAN, quite interesting, would also provide lessons, would be Singapore and Malaysia. I think Ferdinand did not talk much about them, but these are two countries that have spikes in cases, super spreading events in both countries, and then they were able to control COVID. So this is also another story on how, in a sense, these countries were able to manage it. Then finally, of course, we have the two, and if you saw the slide of first, Philippines, Indonesia, cases are still going up. The Philippines going down a bit, Indonesia sort of going down a bit. And so it will be interesting. And we have, of course, worked on this, I think, as a bank. So looking at these countries, grouping them well, teasing lessons from the different paths that they have went into, I think would really be valuable. Now, I will then go now to the second part of my comments, which essentially, as we listen to Dr. Fernando, to Force in ASEAN, there's some pieces of work that they're doing which are really great and would really benefit from support from Ricard and CERD and ADB. They talk about setting up a regional, in a sense, Center for Disease Control. I think it's called the ASEAN Public Health Emergency. Sorry, the name I can't remember the name anymore. It's essentially sort of a center that will coordinate everything: disease surveillance, sharing of information, even probably training of epidemiologists and all that. Lots of capacity that we have seen lacking in a number of countries. So I think it's how I understand from Ferdinand that Japan is supporting this, but this is, I think, one ASEAN intervention that we in ADB should come in and help facilitate. The other two ones which are hearing is that they're planned to have sort of this they want to keep stockpiles of public health emergencies, public health goods, PPEs, including, and of course to have sort of a COVID fund, a regional fund. So I think this is two. I see this as interrelated interventions, and something that would benefit from support from the bank, from us. Whether we help them design it, whether we help them sort of guide them to make sure that they don't do the errors that other stockpiles have done. And finally, of course, something which a lot of us are talking about now, vaccines. They're talking about an ASEAN vaccine self-sufficiency. Is this the right way to go? In a global interconnected world, or if this is something that's correct, how would they actually do it? Would this need and probably Anna will talk about this, harmonization of regulatory decisions, so that vaccines doesn't have to be registered in every ASEAN country? In Europe, you register in one country, you're registered in all. Is this something ASEAN will consider? Again, this is something that we in ADB could support ASEAN. Thanks, James.
Thank you, Dodo. Now let me call on Anna to give his opening statement. Anna?
Thank you very much for having me speak, and thank you very much also to the other presenters and panelists. I think one of the things that comes through very clearly from the presentations is the importance of regional cooperation for ensuring national health security, but not only its importance, but the complexity. Some of the graphs on about the various different ways that ASEAN is contributing to health security are a bit mind-boggling. And a few of the things that I wanted to highlight in regards to regional cooperation, if we're zeroing in on vaccine, so end-to-end vaccine development, delivery, and administration, some of the key areas for regional cooperation that the other speakers have already highlighted include pooling finance for the procurement of vaccines and essential supplies, enabling the trade and the transport of goods to countries, and also enabling the services to be delivered, including, for example, movement of health professionals, coordinating on the surveillance of the impacts of vaccines, and also finally, as Dodo just mentioned, in regards to the authorization and registration of the use of vaccines in countries through reliance and mutual recognition agreements. In relation to this, I'd like to draw attention of the group to the role of national regulatory authorities. And this expands on a point made in Ricard's presentation. National regulatory authorities are the gatekeepers of the medical product supply chains, but they're often overlooked and very often under-resourced. They are responsible for authorizing the marketing of vaccines in their countries, and also monitoring and taking action if there are any adverse effects. For vaccine producing countries, the regulatory authorities have the additional task of ensuring the quality and certifying every single aspect of the production and delivery of that vaccine, and all of the other importing countries in the region are reliant on the capacity of that authority in playing that role. Regional cooperation is a really essential way of building the capacity of the national regulatory authorities in playing that essential role. And one particular aspect that I'd like to highlight now is by using digital information systems for knowledge sharing. This is essential for allowing reliance mechanisms and also for surveillance. So as Ricard mentioned, a few years ago, so between 2015 and 2018, I believe ADB supported Myanmar to establish a fully online integrated regulatory information management system. And the system allows for online sharing of the documentation that is required for registering a new vaccine. It can share the inspection reports for facilities. It can also generate automatic alerts if specific products and supplies have adverse effects. And I understand that by the middle of next year, Myanmar, Laos, Malaysia, Thailand, Indonesia and Singapore are all expected to have same information, like integrated information system in place, which provides a fantastic foundation potentially for a regional level database. I'm more of a trade economist than a health person, so the way I conceptualize this in my head is around the ASEAN single window project, whereby the national level single windows, which allow for all of the different agencies for trade to post their documentation and information to be shared regionally. And some of the benefits of being able to share information regionally like that would be that you could automate alerts and prompts. So if there is a problem identified with a particular batch of a vaccine in one country, all of the other participating countries would receive that alert at the same time and be able to take action. Another benefit is that it would enable products to enter the market more quickly, because they would have, the regulatory authorities would have the information they need to allow and authorize that access. One of the things that I'd like to highlight, particularly in relation to that, is that sharing information and cooperation between regulatory authorities, it's critical in responding to the vaccine, but it's also a really long-term investment in the health system. It can enable faster delivery of vaccines, but it would also enable the identification of counterfeit medical products in the region, which is globally, I think it's hard to estimate, but people estimate something like $200 billion in terms of the cost of counterfeit and fake medicine. And I know within the GMS that one of the particular problems is that counterfeit medicines are contributing to malaria treatment being less effective. In addition, evidence from other countries in the world is that by investing in the regulatory authorities, you actually enable countries which are producing to access other countries' markets. So not only would we be responding to the challenge, we'd actually be building on the opportunity of creating regional medical hub within Southeast Asia for responding not only to this emergency, but also future health emergencies. So I think with that, I'll finish. Thank you.
Thank you, Anna. Thank you, Anna. So let me now go into the question and answer. And for the audience, feel free to raise your hands or actually use the chat box if you have any question. But let me follow up with some of this question about the vaccine, because I think all of us are in agreement that really the vaccine is the most important and could probably be the game changer in terms of COVID-19. And as Ricard said, we need to be able to scale up and be ready when when a safe vaccine has been produced. Let me ask Nima, how do you, there are several issues raised with vaccine. One is issue related to safety. The other one is issue related to the procurement, distribution, especially to frontliners as well as the high-risk group. And thirdly, as well, is a question about the readiness of people in terms of perception, whether they would want this vaccine to be injected to them. So, what's the role of I think regional cooperation and regional institutions such as the WHO and ADB to ensure that these issues are managed well?
Thank you, and thank you to both Anna and Dodo for their comments as well. I'm going to follow up to your answer. Let me put my video on with a couple of observations. Anna, right now in WHO Zero, there is the Southeast Asia Regional Network of Regulators, where their function is exactly or beginning to create the function of rapid collaboration and information sharing, for example, whether it be the adverse effects or be it for agreeing to streamline their approval processes. Of course, WHO being WHO is different to ASEAN, to ADB, et cetera, et cetera. So we're going to see these overlapping umbrellas. And I think at some point we all have to sit together and agree on one set of rules for everybody, with the member states being the fundamental building block as opposed to the regions being the fundamental building blocks, to make sure that there is uniformity when it comes to regulatory. And I think it's an important factor because it is the Achilles heel. And it's not just about vaccines, actually. It's much more than that. It goes into the medicines, it goes into diagnostics, and having in place pre-approved processes so that you can streamline importation. I used to work in Cambodia during the last pandemic, the influenza pandemic, back in 9, 10, 11. And the fact that you actually had to get clearances meant that you could save weeks of the supplies sitting in a tarmac. And it's understanding the bottlenecks in the system. And I think that's an important factor, come what may, vaccine, diagnostics, and treatment, actual treatment, as opposed to prophylaxis, which is fundamentally what the vaccine is. But I also want to say that ASEAN does have a program. It stopped because of COVID, but it did have a program when it comes to management and communication and research and procurement of childhood vaccines, which was being led by NVI in Thailand. So there is some steps back there in trying to create pooled procurement and make sure that they can get better prices and punch above individual member states' height as a group. And so it's about building on some of those activities which are already being thought about, if not at all, if not hasn't been implemented. The other issue, of course, is distribution. And as you mentioned, we expect to see leakage of the vaccine to go to non-essentials when it comes out. And that's to be expected. I think a lot of that is to do with how well the regulation and the governance structure of the health sector is within the member states, within the countries. The role of private sector when it comes to distribution, when it comes to giving the vaccine versus the public sector, and how that's going to be done. And I think those are the things which needs to be thought in advance. I honestly am less concerned, to your last question, James, on making people want the vaccine. There is enough hype, and if you do a good media campaign on this, I would be surprised unless we see vaccines which are of poor efficacy and poor effectiveness, in which case they shouldn't really pass the regulatory step anyway. I will be surprised if there will be too much resistance for this in the ASEAN countries, in our countries. the anti-vaccine lobby might come in specific areas. But there is so much hype for this as a way forward for the economy to open, for the countries to be able to function. I'm less concerned about people refusing in really large numbers to be vaccinated. Over.
Thank you, Dr. Asgard. Let me follow up on the overlapping umbrella and the complexity that was also mentioned by Anna Fink. And let me ask probably Dodo and Ricard in terms of what you presented really in terms of the COVID response is a very sophisticated and complex institutional response. But at the same time, that's also a challenge because as as Nima said, there are so many players, there are so many governance issues within the region and within the country. So what's the role of ADB and how can ADB facilitate and probably provide a simplifying platform to make sure that this coordination and this decision making happens seamlessly? Dodo?
Yeah, James, okay. I thought that Ricard will answer first. Well, one, James, is what, in a sense, that's why I think it's great that we have Ricard here and Ferdinand from ASEAN, because there's a lot of lessons that was done in GMS, which can be used by ASEAN, okay? So a lot of the coordination that has been done, so we need to basically, so our GMS team, and this is a shout out to Ricard, should start writing them up and look at the ASEAN and try to see how this could be adopted in ASEAN, whether it is sharing of information, whether it's lessons from existing projects. So that's one way. So we're already proof of concept. And so part of the problem sometimes in moving ahead with some of the ASEAN proposals may be that it is much more easier to say the things in saying that it cannot be done. You know, we could not have our national our sovereignty when we do national regulatory decisions be taken over by somebody. And that was, I think, Ferdinand can probably talk about some of the concerns that have been raised, that one country will take over the decisions being done by all national regulatory agencies. So that's one. And the second, of course, is that our strength has always been financing. So some of the proposals, whether we're talking about the regional stockpile, whether we're talking about the ASEAN Health Fund, whether we talk about connecting the regulatory agencies, would need some level of financing, whether it's coming from the country themselves or, in a sense, support from outside. So these are a couple of proof of concept financing support. Over, James.
Ricard, any additional?
Yeah, just a quick reflection, and thank you, Eduardo, for reminding me on my work. I agree with you, and as you know, we are about to recruit a person as we speak to help us document 2 decades of investment of health security in the GMS region, and we are pursuing this assignment, and we will start doing this in the last quarter of the year. The study will not be ready until perhaps in the beginning of next year, but I'd be happy to work with all people concerned around that, and I think we'd be happy to work with WHO, with ASEAN and others also, because they all had a stake in it. ADB has not been alone in supporting the GMS region when it comes to health sector investment. We've been one of the partners, but we have been very strong on the regional health cooperation agenda, mainly because we had the GMS platform to stand upon. And as I mentioned in my presentation, we have an agenda up to 2030. So continuing work on regulatory type of work or intra-regional capacity building, addressing vaccines, not just for COVID-19, but future public health threats. These are top priorities that we need to be ready and stand flexible and support the countries. Then in terms of your question, James, and how do we contribute on the national agenda and add value to the dialogues that other development partners, often led by the World Health Organization. Well, you know, we have our resident missions. Not always can we participate in these various dialogues and so on, but we are now quite active in all the countries, including Thailand as well, and PRC. So I work very closely with Najib, who is here now, and he is also preparing a new loan in China. So we are connecting the dots between Yunnan and Guangxi and the other GMS countries. And by continue hosting the GMS Health Sector Working Group with active participation from the countries, I think we would have a good opportunity to push hard for this. And the COVID-19, whether you like it or not, has also managed to put health back on ADB's agenda. And it's very much appreciated in the countries where we work, and where we can, we also participate in various type of coordination settings, and also when the UHC dialogue continue now, and that will be absolutely fundamental as we go forward, and how we continue to invest in health systems and health financing. Over to you, James.
Anand, do you have a follow-up?
Yes, thank you. I just wanted to build on some of the points made. So in regards to the role that ADB can play, obviously the regional platforms that we have and the strong policy dialogue that we have with countries is the foundation for our engagement. I think some other advantages that we might have is that because we have strong pipelines across lots of different sectors, we have the opportunity now to ensure that health is being considered in other major financing areas that we support, say, for example, transport. Another financing tool that we have is the policy-based loans and the results-based loans. And because we're working across so many different countries, well, what the role that we can play is by ensuring that there is some coordination between the reforms at national level to support the agendas that the regional communities are trying to take forward. One final point to say is that one area where ADB is quite unique is that we do have the private and the sovereign sector operations under one roof. And I think that might give us a good strategic footing in terms of thinking about the role that the private sector can and should play in securing regional health security.
Thank you, Anna. Just a quick question to Ferdinand. Where will the Regional Center for Public Health Emergency and Emerging Diseases be located? I think that was one question that was raised by Nima. I'm also quite interested to hear where is it likely to be located?
Okay, thank you. Can you hear me?
Yes.
Yeah, I have a few points to share, but then allow me to respond to that question quickly. The final host country is still to be decided within the ASEAN health sector. There are 7 countries who are interested in hosting it and have already provided documents and information with regard to the required factors and enabling factors of hosting the center. Definitely, the announcement of the host country is expected to be done during the ASEAN-Japan Summit in the 2nd week of November. So much is to be undertaken by the ASEAN health sector in finalizing the selection process and endorsing the host country, as well as recommending certain appropriate and applicable recommendations emanating from the feasibility study that would help in the initial phases of the establishment of the center. There are 7 member states, as I've mentioned. Only 3 have not expressed interest, and this would include Cambodia, Laos PDR, and Myanmar. Vietnam is very much interested as a current chair, and as the current chair, they're also advocating their position in terms of hosting the center. But we will inform partners, including ADB, regarding the final host country about this matter. And if I may, James,
Yes, sure.
I have responded to your question. A second, definitely one of the priorities that is being the focus of attention of all of the pillars of ASEAN, the political, economic, and socio-cultural, is the implementation of the political commitment of the ASEAN vaccine security and self-reliance. And as mentioned by our colleagues, that the lead country for this is Thailand, to the Ministry of Public Health, particularly NVI. So there is already a regional strategy and action plan on implementing the ASEAN vaccine security and self-reliance. And definitely the issues that were discussed earlier are part of the concerns of this particular action plan. However, the priority is with regard to COVID-19 vaccines. Third, in terms of possible sharing of good experiences as a proof of concept, as mentioned by Dodo, in terms of the experience in GMS, there is another platform in ASEAN that is not within the ASEAN health sector, not within the ASEAN socio-cultural community pillar, but it's under the economic pillar. And I have informed this to Ricard before, that we have this initiative for ASEAN Integration, which focuses on the narrowing the development gap and supporting Cambodia, Laos PDR, Myanmar, and Vietnam. In fact, they have their own work program, which is going to be endorsed in the summit in November, that cuts across sectors from the 3 pillars of ASEAN. So it has a work plan for 2021 to 2025. And that could be the entry point of further coordination of the GMS program and with ADB and with the IAI of ASEAN. We call it Integration of Initiative for ASEAN Integration, IAI. And we have a lot of ASEAN partners contributing to this initiative, and that could be an entry point. And also with regard to the whole architecture of ASEAN, first and foremost, it's an intergovernmental organization, as all of you know, and based on the governance implementation mechanism, we have to work within the architecture of a government mindset. And as such, there are certain need for further internal integration and coordination of various sectors initiative. For example, the ASEAN single window that was mentioned, that could be an entry point in terms of further supporting and complementing initiatives in the vaccine security and self-reliance. And sectors involved here would not only be the health side, but also the economic and trade facilitation sectors, as well as those dealing with the health regulation. I just have to point out to our colleagues and listeners that health matters is not only under the ASEAN health sector, under the ASCC, under the ASEAN socio-cultural community, but also it is also being implemented under the economic side, simply because the economic side of ASEAN looks into the barriers to trade and regulatory concerns on health, standards, procurement, pharmaceutical devices, and pharmaceutical development is also under the purview of the economic community pillar. And as such, based on this particular governance implementation mechanism, there is truly a need for further integration across all sectors, across all of the pillars of ASEAN. Over to you. Thank you.
Thank you, Ferdinand. Another question on the health sector workers, specifically doctors and nurses, have really taken a heavy toll, both in terms of lives lost as well as tremendous work pressure from this pandemic. What are the critical things that the human resource for health need, and how do we respond as a region to this? Maybe I'll address this question to Nima.
Thank you. You give me all the hard questions. I think different countries are doing this in a different modality. As I mentioned, in the longer term, there is a program of work going on across Asia, the Asia Action Alliance for Human Resource for Health, to try to improve the number of doctors and the nurses and the paraclinical specialities to just build the numbers, because we know that across the board there aren't enough compared to standards, global standards for doctors or nurses in the region. So that's one factor. One thing which does happen, and again, I know Thailand quite well because of the publication that we did, as I mentioned, was that, converting contractual workers into civil servant contracts, which actually their own perceptions of value that the country has for them. It's more than spending at 5 p.m. every day and clapping for the healthcare workers, but it's actually something practical. We also saw in Thailand, again, examples of increasing the level of life insurance for anybody in the health sector who had COVID related. This is the one done by the government under the national scheme, but also there are examples of private sector as part of the CSR giving life insurance coverage to healthcare workers as a means of showing their appreciation. A big bottleneck is PPEs for the healthcare workers, especially in the first wave, and it's the control comes in multiple ways, from regulating the availability to increasing the capacity to purchase and produce nationally, as a means of, again, offering the healthcare workers some of the PPEs needed. There are examples of good practice where you saw shift working so that the two hospitals don't meet, to minimize cross-infection, for example. So you can go all the way from macro to all the way to the micro in different ways that different countries have tried to tackle the shortage of healthcare workers. Obviously, there are also issues with regards to shifting people from departments and wards, which may not be as necessary during a COVID outbreak. So, if you're canceling operations, then you'll have a staff available who can be shifted to internal medicine wards, etc., as trying to build the capacity on a short-term basis during the acute phase. All examples which have been shown and has been practiced. We know that demand changes in countries where the emergency department are well functioning. Across the board, there was a decrease in requests or for people going into emergency departments because they were worried they might get COVID. So there was an increase in other diseases simply because people weren't going because they were scared of catching COVID in the hospital, so they just weren't going. And I know, for example, in UK, there was a push by the emergency medicine saying, if you're sick, please come. It's important. And they saw that percentage of sick people increased attending the emergency departments. These are different examples, I think, of trying to do HRH capacity increase in the short term. I'll stop here. I wanted to have one comment, but if there's time, I'll come back later on. Thank you.
Thank you, Nima. Dodo?
Okay. James?
Yes.
Yeah. Okay. We in ADB were working with an alliance called the Alliance for AAH, so an Asia Pacific Action on Human Resources, and we've actually been co-organizing with them a series of webinars on HR. This is what we have seen. Most of the countries in Asia and the Pacific had problems. Their current when COVID hit, most of their HR systems did not had difficulty coping. Some of the countries were able to then manage it. Lots of countries have brought in how do we call it, volunteers, or not even volunteers, or were able to mobilize other health workers. A few countries have been unable to do it. At the end, I think this is something ERCD, together, we should look into this, get to document this. We are documenting this, and we'll reach out to you guys to help us. And then, really, this is an opportunity for us, an opening, so that a lot of the HR problems in health, which has sort of been tolerated through the years, basically it's an opportunity for us to study this thoroughly and provide advice. Okay, there is no magic solution right now, as we have seen in the webinars. Each of the countries have their own approaches. There is no sense 1, 2, 3, you do this. We're not at that stage yet. Hopefully, we together with the RCD, well, the rest of ADB and ASEAN and WHO, we could rapidly do this work and take this opportunity to give much better advice and hopefully help countries implement reforms in health human resource. Over.
Thank you, Dodo. Now, last comment for Anna.
Thank you. I just wanted to add on the health workers aspect. In regards to regional cooperation, one way of building the availability of health workers would be through labour mobility within the region. And there's already the ASEAN frameworks for mutual recognition of health professionals, but it's perhaps not being utilised to the extent it could be. And one of the reasons behind that is just practical day-to-day reasons, for example, issues around language. And one of the big things is the ability for a health worker who is moving from one country to the other to receive basic social protection when they're in the other country, so that they're still receiving contributions to their pensions, that they still have health insurance. So having some harmonization of and access to social protection can be a critical element in terms of allowing mobility within the region of health professionals to respond to emergencies.
So with that, may I call on the keynote presenters and the panelists to turn on their video so that we can actually give you a warm hand of applause. We've come to the end of the webinar. And for the next webinar, we will have the webinar on October 26th, and we will be discussing our new and upgraded measure on regional cooperation. This will also be held 26 October, 3 p.m. to 4:30 p.m. With that, thank you everyone for tuning in, and thank you to all the keynote presenters and panelists. Goodbye.
Thank you. Thank you.
Thank you. Goodbye.
Thank you, Ferdinand. Thank you, Nima. Thanks, Anna.
Thank you, everyone. Very interesting.
Yes. Thank you.